So while talking about plastic surgery, I feel like, you know, everybody has a feature that they do not really like, let's say, so much. I have the ones that I don't like, but I'm never going to have them changed. I feel like it's just a part of me. However it is, they can be okay, they cannot be okay, but that's a part of me. I feel like I am extremely scared of nip tucks and surgeries, but there are many brave people out there, so good for you, you guys. Now, with that, we are back with Dr. وليد. Dr. وليد, I was asking you a question in the break about, let's say, if a person, because there are many people now, even when the wrinkles are not really showing that much, they're getting fillers in their face, they're getting Botox in their face. Does that actually help when you age? Let's say if you started with the fillers at in your mid to late 30s, is it going to help decrease the wrinkles by the time you get to your 50s?
Sure. It's in the beginning I mentioned that there is some complementary treatments for aging of face, and we mentioned Botox, fillers. Yes, sure. It can how to say make the aging come later, if we can say, but the process of aging is here.
It cannot be stopped.
Yes, we can how to say make it
better, yeah,
but not to stop it completely. The needs for facelift always exist.
There. And of course we will always need plastic surgeons, but doctor, if we can talk more about the different kinds of facelifts, as you've mentioned. There's like the miniature one, there is the very extended one as well. Now let's say somebody already has gone through the facelift surgery, and they have had the results that they wanted. But I feel sometimes when people see a good result, they get greedy for more. So after like maybe 10 years or something, they want to come back for another facelift.
They can come back.
Are there any reservations? Because of course, when the face is getting altered, I'm saying altered as if you're going to the tailor, but never mind. When you're having the facelift, a full facelift the first time, is it so that there is more room to play with, because that's just the natural structure of the face? You have extra fatty cells and everything. But when you have already taken some of that off, how much can you do the next time?
Well, there is the skin is elastic. And with the age, the elasticity of the skin will decrease.
Yeah.
And the laxity of the skin and muscles come back after 10 years. Perhaps not the same degree of laxity, but after 10 years, there is laxity. We discuss another time if the patient needs a mini facelift or an extended facelift second time. Okay, but we can do several times in life the facelift.
Okay, now doctor, if we can talk about this, the facelift string. Now, is it literally a string that goes in?
It's a thread. We said in our medical terms. We use the term thread lift. The thread lift, yes, they are like the threads what you use to make stitches, but they are, how to say, more bulky to use them to lift and tight the skin. Okay. It's a thread, yes, it's a thread, but done by materials what we use in surgery in general. Okay, there is the long-lasting threads and the fast-lasting threads. For long-lasting threads, we can do the procedure under local anesthesia. We need a small incision in the hairlines, and it will take about 1 hour. It can give us a result not equivalent, but like a mini facelift. Okay, and in case
and it's less invasive.
It's not it's always it's invasive because there is a
pulling and strings.
Yes, but it's less invasive for sure. It's a an office procedure. We don't need to go to hospital and operating room. In the clinic, we can do this procedure, and the patient can go home immediately. 4 to 5 days later, they can go back to their social life normally, without any problem. There is no complications, and we have the soft face lift by threads. It's a procedure completely. There is no incision here. Okay.
Okay.
It's only by needle. We go behind the skin by a needle, and it will take time about 30 minutes, half hour in the office, and the patient will go home without any problem.
So there's definitely many different options, and pretty much the physician and the patient they really need to consult about it and discuss about the options.
For sure.
Indeed. And definitely, Dr. وليد, thank you so much for joining us today. It was an absolute pleasure. Any last word of advice or any last message you would like to give?
First, I'm really, it's a pleasure for me to be today with you and to talk about facelift. Plastic surgery is not one procedure. Always we must to have a box of tools as a plastic surgeon, and the plan of treatment must to be custom made for each patient. We cannot say this patient or this lady needs the same procedure as other one. Okay, each one has his own procedure. Let's say this.
It's definitely good advice to tell the people, because I don't want them to go ahead to go to a physician and say, I want the same thing they had, I want it on me. Definitely, again, thank you so much, Mr. وليد, for joining us today, especially in the discussion of facelift surgery. And hopefully a lot of dear viewers at home, you have that type of stereotype in your mind where facelift is just a facelift. But there's definitely many different things, as they will say, many strings going behind there. So you should definitely go ahead and be well informed. That was Dr. وليد حريبه, plastic surgeon, a discussion about the topic of facelift surgery. And I'm sure that many of the people at home, if you have that consumption that facelift will definitely make you a better individual, it doesn't. It just goes ahead, it makes you 10 years younger. You're not going to change your appearance as much into someone else. Just go ahead and age gracefully and be happy with who you are. At the moment, the viewers will be taking a short break, and we'll join right after this. Stay tuned.